I'm Dr. Nan Boss, owner of Best Friends Veterinary Center. I want to talk to you for a bit about pain management. People always ask me, how can you stand to put animals to sleep? That must be really hard to do. For me, putting an animal out of its suffering is easier than watching it suffer. The thing that I have problems with is pain that's either not been adequately treated, struggling to explain pain to a client so that they will actually administer pain medication to their patients. This can get pretty frustrating. I'm pretty passionate about pain management, so you'll probably hear my voice go up and my face will get red because I just hate it when my patients are not pain-free. Many pet owners expect their pets to behave like children when they are hurting, but that's not what animals do. They rarely whimper or cry. Instead, they behave like us, like adults. With severe pain, the temperature and heart rate will be elevated, or the pet may flinch or try to bite us when we palpate a painful spot. I think when it's obvious, like lameness, people can pick up on pain, but even there, I have a lot of clients that'll tell me, oh, he's not painful, he's just stiff, or, well, he's not using the leg, but he's eating and he seems fine. Well, if they're not putting the leg on the ground, it's because it hurts. And minimizing it and saying, oh, my pet is not in pain is kind of unrealistic. If we give the pet pain medication and he uses the leg again, that tells us right there that it was hurting. In fact, one of the best ways to tell if a pet is in pain is to give pain medication and see what happens. If the pet acts differently, eating better, more active, wanting to play more, then the pain medication is taking pain away and we should continue with it. Not doing something usually means that it hurts to do it. Not using a leg, not jumping on the bed, not going up steps. The signs of pain in animals are often subtle. Posture and body language can reveal a lot, but most people aren't attuned well to noticing these changes in pets. Things to watch for. Are the ears and tail up or down? Do the facial muscles look tight? Are the eyes worried or partly closed? Is the pet hunched or curled in on itself? Is the posture relaxed and comfortable, or is the pet holding itself in an odd position? Is the pet interested and aware of its surroundings? The more painful it is, the more likely it will be concentrating very hard on the pain and ignoring the rest of the world. Does it want to participate in its usual activities? Is it eating and drinking normally? Can it urinate and defecate comfortably? Is it protecting a painful area? For cat owners, lack of grooming is a common pain symptom. If it hurts to twist and bend around, a cat will stop grooming. Dental or oral pain can also cause cats to not want to lick themselves. On the other hand, obsessively grooming a certain area of the body may mean that spot hurts. Please don't worry unnecessarily about using pain medication for your pets. Modern drugs are very safe and very effective. We wouldn't be prescribing them if we didn't think the benefits far outweighed the risks. Most people have a fairly simplistic view of pain and the whole process around pain transmission. Pain is actually a very complex phenomena. There are multiple types of receptors that can send pain signals to the brain. So pressure that would cause bruising versus an incision that's cutting versus something hot versus something very cold. Those are all different receptors. In chronic pain, we tend to see more and more of those pathways engaged, and so you're likely to need more and more pain medications of different types in order to cut back all those different types of signals. So when we have an acute injury, poking with a pin, or we make an incision, that pain sensation is pretty simple, and most of it goes up to the brain and is perceived as pain. We do have some feedback loops and different transmission routes, but it's fairly minimal. Things get more complicated when we have inflammation as part of our pain process. So when we have redness and swelling, that's the body sending out chemical messengers. Well, the body is then going to dilate the blood vessels, which causes the area to get red and cause swelling and edema. To some extent, that swelling and the redness is beneficial because it does help the tissues to heal. On the other hand, all those chemicals that are telling the body that those cells need help are also stimulating pain. And so the more swelling and inflammation you have in a painful area, the more pain sensation is going to be going to the brain, and the more ways it's going to get to the brain, so that you have to use multiple medications in order to get things under control. Then we move on to chronic pain. which is a very interesting phenomena because the longer pain has been going on, the more pain pathways are recruited and the more complex that pain becomes. It's kind of interesting that the more pain chemicals are put out, the more the body says, oh, I'm using them up, I need to make more, and then there's more pain chemicals to cascade and make things worse. And so chronic pain recruits a lot more nerve pathways and it tends to be the hardest to get under control. It's generally much easier to prevent pain than it is to treat it once it's there, and part of that is because of all these pain pathways that get engaged. If we can catch things in the acute phase, do our non-steroidal drugs and our local anesthetics so that the inflammatory process doesn't kick in, we can also often help prevent chronic pain. If you hear a grunt or whimper when a pet does attempt to jump or when it lands, that's often a red flag. Subtle symptoms that you sometimes see with facial expression or the position of the ears, the body posture or being tucked in. This picture is a dog, again, with severe abdominal pain. So most people would not look at this picture and think, oh, this dog is excessively painful, but this dog was in agony. He is staring at the wall. His eyes are narrowed. He is concentrating so hard on the pain in his abdomen, he's not even very aware of what's going around him. He's standing in an awkward position. His feet aren't placed underneath him like you would expect a dog to look. He doesn't want to sit. He doesn't want to lay down. He has himself in kind of a weird sawhorse stance because he is so painful in his belly that he doesn't even know how to make that feel better. Something that clients tend not to understand very well is multimodal pain therapy. So we talked about there being multiple pathways for pain. So many times when we send a patient home from surgery or when they have chronic pain, we're using 2 or 3 or 4 different medications all at the same time. And people get really worried about side effects and are we giving too much medication? But we have found that, again, the more places you can break those pain pathways, the more effective that you are going to be. You actually have often less risk of side effects if you're using 2 or 3 medications because your doses for each medication by itself are going to be less. If you're trying to rely on one drug, you're usually going to have to stay at the top of the dose range, which means you're going to have more risk for side effects. If you're using 2 or 3 drugs together, you often get much better pain control using less of each drug. But when we have chronic pain, when we have severe pain, we need multiple drugs in order to keep that under control. Otherwise, half of the pain sensation is controlled, but the other half is not. And the more types of receptors that are firing off, the more sensation you're going to have going to the brain. A little pain is part of life, but no pet should suffer needlessly from treatable pain, especially when it is severe or chronic. We can help.